There's no health security for the United States without global health security. We cannot build a wall that is tall enough to keep diseases out. Unless we lead, other countries won't follow. We're never going to be safe from this disease in the United States until we extinguish it on the planet. We live in an interconnected world, and we are only as safe here as the weakest link in the global healthcare system. While WHO made mistakes here, frankly, just to be blunt about it, the mistakes the Trump administration made were much more significant than the mistakes WHO made. The evidence of that is that every country in the world shares the same WHO, but our country has a much worse coronavirus problem than other countries. There are only two ways to fight an epidemic. You overdo it or you underdo it. What we're seeing right now is the consequence of underdoing it, and the consequence of not having hospitals be prepared, not intervening enough overseas, not having enough overseas surveillance, not staffing up CDC enough, not doing these things. I think it would have been much better if we'd had a national approach, a national strategy, but the Trump administration abdicated that responsibility and basically threw up their hands at that. The way you get this disease under control is the way you get all epidemics under control. You test for it, and then you isolate the chains of transmission, you contact trace, and you bend the curve. You first have to test first, because if you don't test, there's nothing to trace. We're not anywhere close to the number of tests you need. We're not even ramping up towards that number. I think most of the experts think you need 500,000 to 750,000 tests a day. Germany is testing at about 3 times the per capita rate that we're testing, perhaps even 4 times the per capita rate. They're doing many more tests in a much smaller country. If the federal government isn't pushing testing, and it's up to the states to push testing, there's a certain self-fulfilling prophecy here. If you don't test, you won't know where the disease is. You won't know how much of it there is. Parts of the country will be open and parts will be closed, and that will have a lot more to do with politics than science. They're going to increase activity, they're not going to test, and then they're going to say the disease isn't there because they're not measuring it.
And don't forget, we have more cases than anybody in the world. But why? Because we do more testing. When you test, you have a case. When you test, you find something is wrong with people. If we didn't do any testing, we would have very few cases.
We often think about the economy in this context right now as if it were a light switch. It's either off or it's on. And I think that's the wrong metaphor. The right metaphor is it's a dimmer switch. It's neither completely off or completely on. Right now it's turned down low, but we always should remember it's not off right now. The incidence of the disease has to come down. You can't send people back out into the workforce in greater numbers. You can't send people out onto the subway or the streets or buses to get to work if the disease is at the level it's at right now in most of our major cities. You need to make sure we have healthcare systems that are well enough equipped, well enough staffed, robust enough that they can deal with the outbreaks that will come when you start to increase levels of economic activity. If we're going to send people back to work, they have to go back to work safely. That means they need protective gear, not just for our healthcare workers, but we're going to have to send waiters and waitresses back to work with protection. We're not going to work elbow to elbow in this world. We're going to have to spread people out more, change the way we manufacture things. It isn't just taking a date, circling it on the calendar, and saying that's the date things go back to normal. I do believe eventually we will get a vaccine for this disease. We're going to have to persuade people to take that vaccine. And given how infectious this disease is, the rate at which we will need people to take the vaccine is very high, well over 85% probably. Right now, only about 55% of Americans take the flu shot. So we're going to get this vaccine, and there'll be crazy theories on the internet about it, and crazy theories on social media about it, and the president will say crazy things, and all that's going to lead to a controversy of whether or not people should take it. That's going to seriously impede our ability to get compliance. Other countries take their cues from us. There are benefits to that leadership. Benefits in making us safer, definitely, and benefits in the advantage we get in research and development, in the learnings we get from being the leaders overseas, and pioneering cures and therapeutics and other kinds of countermeasures to these diseases. What happens if the vaccine for COVID isn't a US discovery? What if it's discovered by an overseas lab? What if it's manufactured overseas? What if we're in the position of having to ask other countries to send us doses of that vaccine because it's developed someplace else? That could happen. Maybe it won't, but maybe it will. And so US leadership is not just the right thing to do in terms of kind of morals and humanitarianism and the history of our country, all powerful dynamics, but to make us safer and to make us more secure, we have to lead.